Sentencing policy in India, in criminal justice delivery system, discussing the you expert of mine also, we are working on that. When all said and done, we know that in that criminal justice delivery system, in the end of the day, after conviction, the learning judge would be looking at all those aggravating and mitigating factors is what is giving the appropriate sentence. And there, that particular decision making will be a human decision making only because that has to take into account a variety of factors, controllables, incontrollables, and surrounding factors. Friends, well, I have an interest to share with you that in our Indian philosophy, the aesthetics, we have those concepts called guardrails. These are those 9 human emotions or sentiments, starting from love, then the first one, then laughter, sorrow, anger, energy, fear, disgust, wonder, and finally peace. Now these are human sentiments, and they are integral part of decision making when we are dealing with human beings. And these are the factors where a human brain who is capable of empathy is at work. So we take the help from machine for sifting across the things, putting the things in order, but then at the end of the day, the final decision making definitely remains with the adjudicators, and there we ensure, we all as the law professionals, what is required for us to ensure is that since we all are dedicated to the constitutional morality, this black box system, whatever we use, it remains a glass box for all of us, transparent altogether. Thank you so very much.
Thank you. Thank you so much, sir. And as we conclude with this session today, there are 3 important reflections which stand out very, very clearly. The first reflection is that technology is no longer at the periphery of judicial system. It's already becoming a part of the main architecture of this entire judicial ecosystem. And all kinds of initiatives which Supreme Court has already taken, they very well demonstrate that we are on the way towards institutional reforms for adopting and adapting to this technology. The second important reflection here is that no matter what, every development, every technological advancement, every framework which we create should be constitutionally anchored and human-centric in its approach, because it's we human beings who are at the end of it. And the third very important reflection which emerges today is that the future lies not in replacing human beings, which is the extension of the previous one, not in replacing the judicial system, but in strengthening the entire system when it comes to equipping courts and judges with tools, technologies that enhance research, streamline case management, and reduce pendency, and of course, expand access to justice. So with this, the roadmap ahead, which is a very important key takeaway from this important panel discussion, the roadmap ahead requires clear ethical guardrails, it requires transparent implementation, it requires institutional oversight, capacity building within the judiciary, and finally, and very important one, continuous public trust. So with that, we conclude the session. Thank you very much, everyone. On behalf of National Law University, Delhi, I extend my sincere gratitude to all the panelists here, Justice Maheshwari ji, Shardul sir, Vikas, Arya, Rajneesh ji, to each one of you for taking out time to join us for this panel discussion. I also extend my sincere gratitude to my team, to India AI Impact team, Dr. Sonu Gupta and her team, for giving us this important platform for this deliberation today. And to, of course, all of you, each one of you, all the participants, for your thoughtful attention and engagement today. So, with this, I would request my colleague, Dr. Nakshana Chandra, to present a token of gratitude to the panelists here. This is the memento from MIT as well as National Law University, Delhi. Shardul sir.
आप उनसे इसकी ऑब्जेक्ट बिल लगेगा ना?
हाँ देखते हैं, दिखाऊंगा।
Yes, जी।
नीचे बोलो। हाँ हाँ देखो।
Thank you very
हाँ,
much,
देखता हूँ।
everyone. Thank you.
हाँ चलो देखता हूँ। हाँ देखता हूँ। अब इसको लगा के देख लो जब तक। इसको लगा के देखो फिर। इन्होंने नई तार भी मंगा ली वैसे तो। नई तार भी मंगा रखी। ये लगेगा नहीं ना, स्लॉट भी तो इसका ऐसा है, ये भी नहीं लगेगा।
introduction, RIS, ICMR, and Health AI for bringing this erudite panel together on this very, very important topic from guardrails to adaptive governance.
मैम अब ऑडिएबल है
As all of you are aware, and the director
मैम ये वीडियो का भी कह रहे हैं चलते सेशन में छेड़ नहीं सकते
is no longer a futuristic concept in health systems. It is already there.
मैम ये कर नहीं रहे 1 मिनट में कॉल आ रहा है विजय कुमार सर का
Diagnostics and public health surveillance. AI is reshaping how health systems work, particularly in the resource-intensive sector.
हेलो
AI holds an enormous promise, improving efficiency, equity, expanding access, and strengthening the system performance. But alongside this promise comes a very, very fundamental challenge. And
Hello.
the challenge is that unlike the traditional
Yes, sir, Dipansh.
authorities, AI systems are dynamic. They learn.
यस
Public trust. Existing regulatory approaches provide essential guardrails. However, they are also rooted in static, hard law models that struggle to keep pace with fast evolving algorithms. And without adaptive governance, we risk ethical drift, data bias, database bias, opacity, and amplification of the already existing inequity, particularly across India and the broader country, where digital adoption is advancing rapidly, sometimes even ahead of the governance framework. India stands at a very, very critical standpoint. With digital public health goods like Ayushman Bharat Digital Health Mission already in place, we are not here to just adopt AI, but also to shape governance models that are contextually relevant, equitable, and globally instructive. So, as the Director General just mentioned, we are moving in this panel from a single-track regulatory mindset towards a two-track adaptive governance model. The first is regulatory guardrails across the AI total product life cycle, from development to deployment and to post-market monitoring. Second, a contextualized AI, intent technology assessment framework, one that integrates ethical, societal, and equity dimensions alongside traditional assessment of cost, utility, interoperability, and system impact. And these two systems, these two tracks, they are not working in parallel in silo, but they need to be intertwined. And today, in this session, we aim to bring, to discuss AI governance, but to not only to discuss AI governance, but to collectively reflect on how to ensure that AI in health is safe, trusted, just, and most importantly, responsive to the realities of global health. So without much ado, I will request Mr. Rado to take this conversation. Thank you so much.
Thank you, Monica. And just to introduce myself a little bit, I'm Rado, I'm the director of AI at Health AI, and I've just really the opportunity to tell you more about what we do at Health AI. So, out of the introduction, I'd like to start this conversation with just two short paragraphs. Sorry, I see the time going. The first paradox is digital health and AI technology is growing faster than policy cycle. And then, not only are they evolving faster, but when we talk about policies, we need to take into consideration aspect that Monica raised earlier, that AI solutions are not just the solution that we use as a medical device supporting clinical decision support, but all the AI solutions that are used for wellness, mental health, optimization in the hospital operations. So all these applications that are non-medical. So there is really that duality that we need to take into account. The second dominant paradox is that often we see a trap that many countries are waiting for the perfect regulatory framework before acting. So that raises the question, how do we foster more innovative governance approaches? And this is really the question that Monica asked earlier today. And this will be the topic of the conversation today. But before we answer that question, let me just quickly talk about health AI. So we are a global agency for responsible AI in health. We're a network, independent, non-profit partner, and we're based in Switzerland. And we have national and regional capacity to regulate artificial. We convene governmental authorities under one global regulatory network. That's what we do. We will work and partner for different states. And basically we help those countries develop and strengthen national and regional validation.
Hello. चल नहीं रहा यस सर पॉडकास्ट रूम है सर ये कंसोल की तरफ से स्क्रीन ब्लैक हो गई है हाँ उधर कंसोल की प्रॉब्लम आ रही है ऑल फोर को बार बार ये सेशन तो सेशन एक हो गया हाँ ठीक है यस सर बोर्ड में कोई कह रहे हैं हमारी चेंज लाइव कैमरा बोल रहे हो कि क्या
Pre-established global repository validated the app that actually shares the existing AI solution that exists around the world, or at least around the countries we work with. And then establish a global early warning system. And actually today, we already have 10 pilot countries that represent 28% of the world population, and that's also 8 countries as part of the global south. And as you can see, as a 10 pilot countries, 2 are still to be announced. So we're signing up contracts, we'll announce them hopefully within the next. On top of our activities with the Global Regulatory Network, we also have a community of practice where it's really about thought leadership and sharing best practices for responsible AI in healthcare. So what do we do with those countries? And I have to tell you, India was one of the first signing as a pioneer country for our Global Regulatory Network. So we work as an implementation partner, and we have a technical acceleration framework that consists of 5 phases. So the first phase is the baseline assessment, where we really discuss with our sponsor, engage with the different authorities, and make an assessment of the readiness of the country. Then we do a discovery workshop, and then we have the strategy planning phase, which is the navigator, which I'll discuss in the next slide. And then that when we roll out the capacity strengthening and some monitoring that allow us to go back to the baseline assessment. So you can already see here that we initiate that circular approach. And it's not just like one big tunnel where we just go one linear and then we start up here like regulations.
Hello.
Let me take you through the navigator and why it's so important. So it's our implementation planning tool that translates the gaps and opportunities we identify in the baseline assessment and we turn them into actionable steps across the key responsible governance dimensions. So, we already mentioned earlier in the introduction that in the world today we have dynamic AI total for Hello. And next to these hyperdynamic AI total product lifecycle practices, we have static and linear regulatory processes. Last but not least, we have high-level healthcare governance requirements. These are all the guidelines. It's very high level. It's oftentimes difficult to just translate them to how do I put them in the real world, in my own context. So what we've done at Health AI was package all these together in the total governance map to navigate from aspiration to contextualized execution. When you ask yourself the question again, how do you foster more innovative governance approaches? Then we can look here again. When you look at just the regulatory approach, it's very waterfall, it's very linear. And when you look at the total product life cycle approach, it's very cyclic. So virtually, you could start anywhere. So for any country, you can say, this is my position today, and I'm starting from there. So if I take the question, well, actually, this global guidance and my priorities are really to create evidence, then we can use that mapping to help you redefine your regulatory processes and policies in a more dynamic framework for medical devices and non-medical devices. This is really what we're doing at HealthAI, working those tools. So how HealthAI and its navigator can assist you? So it starts with, as I said at the beginning, the global regulation network and the partnership we can do. As India, as the global south, there is already a network of countries that can work within our ecosystem. That can help define shared common frameworks, for instance, RAN mechanisms, and then from there, we can use the navigator tool to use the total product lifecycle to anchor your regulatory rigor. That's really for the safety, transparency approaches. But as we mentioned earlier, it's not enough. So we have a health technology assessment, well, AI for health technology assessment, because we need to make that distinction, which health technology assessment usually just associated to medicine. And we really need something specific for digital health and AI technologies. And we have a blueprint where you can weave in all the aspects of value and economy, clinical workflows, ethics and equity balance, and socio-technical constraints. And why does it matter? Because this is the instrument you need to contextualize your need to the realities of your own country. And then you have a regulatory sandbox blueprint package where basically you can build a control and stepwise real-world learning and evidence. Through that mechanism, which is an example of what we do, and that's what we want to discuss with the panelists today, it allows you to move faster without breaking trust. But most importantly, as a country, we can use those methods, use those innovative approaches to reimagine health and care altogether. Thank you very much. I'm sorry I had to rush through the quick note, but hopefully you had a view on where we stand. And I'd like to continue with the panel discussion. I need to excuse. Before that, we have group photo, but I really need to apologize on behalf of Anand Pan, who's been delayed with his flight, so he cannot attend today. Yeah, we can have a group photo now. All right, so let me quickly introduce our panelist here. Okay. Again, sorry for Anand, he was good and resting, but let me start with Dr. Vidushi Chaturvedi. So Vidushi holds a PhD in international politics from Jawaharlal Nehru University in New Delhi, and she has served for more than 20 years as an Indian civil servant in diverse sectors including social, finance, and technology. And as part of her engagement in Niti Aayog in Frontier Tech Hub, she has been addressing questions on emerging technology innovations, helping to solve problems faced by humanity, or on the impact of transformative technologies such as AI on gender justice, climate resilience, sustainable development, societal values, and trust. Dr. Ricardo Corpus, next one, is a pathology senior lecturer and head of the Department of Basic Science at the Manan Prasad School of Medicine and Health Science, University of Fiji. He also lectures in telemedicine and digital medicine, preparing future clinicians to navigate an increasingly digital and AI-enabled healthcare ecosystem. Grounded in clinical practice and scientific rigor, he brings a unique integrated global South perspective to the evolving conversation on responsible AI in healthcare. Dr. Apurva Dharmendra, welcome. So after completing her medical training, Apurva pursued a PhD at the National Institute of Mental Health and Neuroscience. Her areas of interest include child and adolescent psychiatry, particularly neurodevelopmental disorders and neuroimaging, and prior to her current role as senior editor at the Lancet Regional Health Southeast Asia, Apurva worked as a clinician in child and adolescent mental health in scientific publishing. Hetham, last but not least, Hetham Eldush is a senior global health advisor at the Norwegian Agency for Development Cooperation, working on international development, health financing, and digital innovation. His work focuses on strengthening health systems and supporting equitable access to health technologies through development cooperation and strategic partnership. So you can see that this panel is quite diverse. Yeah, you will have other sessions today around resilience mechanism, around sandboxes that are more technical, and I think we really wanted to put it as a strategy with the panel session that has multiple perspectives. And I will start my question with a because working for you're actually setting the scene, so to speak. And I have lots of questions about real-world evidence, but I'd like to frame it more with you on the strategy side and the influence for our concept. So are there particular regional or topical gaps you'd like to address, like sharing with us more in this context of Global South and innovative outreach?
Thanks so much, Redo. I think, so just as Dr. Redo mentioned, I'm from the publishing side of things, and I'm from the Lancet, which is particularly the Lancet Regional Health Southeast Asia, which is a journal that publishes all about the health concerns of the countries belonging to the WHO Southeast Asia region. And like you said, it's a nice platform to have. We aim to give a voice to all the diverse stakeholders of the region. So the way I see it, there are things that can be done from all sides. So from an editor's perspective, how much are we encouraging research that is coming from our population that perhaps has a smaller sample size or is something that is novel to our region, perhaps not to the world? Are we putting out calls for that kind of research? Are we putting out commissions? Are we encouraging policy pieces? That's what we really need to see to support. And we need to also, so if people have this kind of research, they need to be aware that there is a platform for it and it has value because it is representing this population. We can also ensure diversity in, say, the editorial board or the peer review process to make sure that we are looking at it with the correct context, so we are able to appreciate the value of that piece of work and that research. From the author's side, we can standardize we can, as we worked with all other research, we're going to also need to sort of standardize a set of protocols for this sort of research that's coming in. How transparent is the data? Where is the provenance of the data? We need to be, very clear on what we're doing with what is coming to us. And yes, and I think that is what we can do from our side as a publishing industry. And we need to give this more of a space because this is the future, and we need to, prioritize these pieces more often. And from our end. Thanks.
Thank you, Apurva. I have more questions from what you said, but I'd like to give the chance from the other side, the scientists and lecturers. So, Dr. Ricardo, if you'd like to really give us your words as a clinical doctor and lecturer in digital technologies for health, what are the opportunities and challenges faced by the future, but the global south in general in responsibility, and especially why we need more innovative approaches for governance, reimagining health and care.
Okay, first question was the challenges. So the challenges not only in PG but in the global south. Number one, in using AI, we need to have a very strong internet connection. But so far in PG, we have this problem with our internet connection wherein we are being cut sometimes, not because we're not paying, but sometimes weather disruptions. And also for challenges in AI, people should know how to use AI. It's like AI is the student and you are the teacher. From one movie, they said there's no such thing as bad student, but a bad teacher. If you put a bad prompt or order to that AI, chances are you'll have a bad command also. The student will have a bad command. So that's the challenges. Can I have the complete one? I forgot the second.
Yes. What are the opportunities?
Yes.
And why do you need those adaptive governance?
For opportunities, number one, for example, in not only in Fiji but not only in India but in all countries, there's a lot of patients. In having AI, we can now streamline or triage what is needed, and because they are very fast in knowing those things. The patients, you can now have much more understanding of your patient rather than you read it for an hour. The AI will read it for you. But again, depending on the prompt that you'll be giving. The opportunities, it will shorten our time when we have AI. But I'll quote this again, there's no such thing as a bad student but a bad teacher. If you are bad in doing the prompt, you will really have bad results.
Thank you, Dr. Ricardo. I think you raise a point that is quite important because we often talk about regulation, but when we talk about governance, it's like all aspects. I think and education is quite critical. It's not really just how we think the AI systems learn, how we get our citizens as well to make better use of it. Thank you for that point. Then from there, I think it's quite important to look at the technology perspective. And then I will ask here, Dr. Vibushi, for you, I mean, the current work you're doing and the book you're writing, I think it's quite interesting. And again, I mentioned about education, but even before education, I think when we talk about all these digital solutions, and Dr. Ricardo mentioned, you have problem with the internet. The infrastructure needs to be done. The digital setting needs to be done. The IT expertise needs to be done. And from your work, how is India driving this adaptive governance for the country and the global south at large through technology and enablement?
Thank you, Rado. Good morning, everybody, and thank you for having me here. It's a great opportunity. As far as governance is concerned, I would like to say that the end goal has always to be kept in mind, and we have to be very clear of what is it that we are aiming at when we talk about governance. And of course, in the case of AI, we know that AI is evolving so fast that governance is a very, very huge challenge, not only for us in India, but all over the world. And because, when we talk of governance, we would like to keep the values, the ethics that is very, very specific to this part of the world, very central to whatever we try to do when we talk of governance and policy formulation. And therein, India is taking a lead in bringing together the Global South. And as we know, this is the first biggest conference on AI in the Global South. And India took a lead during the G20 and conceptualized the digital public infrastructure. And the public part of it is very important because it comes from the doctrine of public trust. And at the end of the day, it is the citizenry, it is the people, it is the individual who's the owner of whatever assets are created and whatever assets have to be governed. So that is to be kept in the mind always. So that is the human and the humane aspect. And when we come to the Global South, we know that AI is a technology which has been concentrated, whether it is development, deployment, conceptualization, by a very few hands in the global north. And that is the reason why the Global South has to come together. And AI is forcing us, there is no other way. We have to cooperate and partner with each other. We have to create an R&D ecosystem. Because it's not that, one country or one part of the world can do everything. Global South cannot do anything without coming together. And that is what is all about this conference. The realization that we can work only as partners. We cannot work in isolation, in silos. AI has taught us that. So when we come to the governance part of it, of course, inclusion, the values of Global South, that is peace, tolerance, democratization of technology becomes very, very central to whatever we do. And therefore, the partnership becomes very important. It's not that I'll go solo, because we know that AI is a two-horse race. And what are we going to do? Are we going to sit as witnesses to whatever is unfolding before us? Therefore, conferences like this bring together governance people, policy makers, researchers, academicians, and of course people at the helm of affairs to realize that we cannot be left behind. We have to set the agenda. We have to see that these are the ethical values that have to be inbuilt into the AI models. And of course, the AI models are being built with a motivation and with an incentive which is a little different when it comes to the global norm. So we have to see what are the ethical values that we cherish the most in the Global South. And that is, of course, talking about inclusion, because we are yet to climb the development ladder. So we cannot afford to leave anybody behind. Democratization is very, very important to us. So look at the models that are being developed. There's so much of violence against women. There are child health issues. When we make a model, we keep these things in mind, and we are not, focused on creating models which are only attuned to creating profits for us. We think of people, 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 and as we know, people, planet is also one of the goals of this conference. So I think that's what I would like to point out at this juncture. Thank you.
Thank you. Thanks a lot. Actually, before we go to Haytham, because Haytham is here because you represent the center of all of this. And what you just said must resonate a lot. But just before that, there is a question I have, and then we let the audience ask questions because it seems more time, and that's really good after Haytham's talk. But the question I have for all of you, so when you talk about the Global South, you always
So again, collective action is important for all of us, especially where the technology is. One of the main challenges, now I'm changing my points. The main challenge is, if you have a data set that is geographically biased, because the models, the tools, the medical products are trained in a different population setting, and then you would like to apply it in another setting. This is as a recipe for catastrophe, because at least it will lead to mistreatment, misdiagnosis, and exclusion. The extreme end is it might lead to death. So this is, or at least it will make the solutions and products that are made somewhere will not work in that the recipient part. So these are the biggest challenges that we need really. And in that context, localization has got a new dimension. That's why education, infrastructure, capacity, regulatory capacity, and so on is very important, because you will never have localization unless you build these pillars and you put that in place. So this is my reflection on this. If I have a few minutes to go back to my points, because I represent the Norwegian Development Agency, and we are under the Ministry of Foreign Affairs in Norway. So we are a development agency, so we manage funds. And we manage the global health funds in Norway. And global health has been one of the main priorities for development assistance in Norway. Innovation has been one of the main pillars. And we have been doing this in 25 years now, almost, with great success in bending the mortality curve. So because innovation saves lives, cut costs, strengthens health systems, and improving quality of healthcare. And that's why, going back to 2010, before the MDGs deadline, innovation came into the agenda, top of the agenda. Because of that, because we wanted to accelerate the achievement of the MDGs. Sounds familiar? Now we are not on track to achieve the SDGs. So that's why innovation is important, right? In addition, so coming out of the pandemic, we appreciated how innovation helps in the response during the pandemic, and then strengthening health system post-pandemic. And why we would like to strengthen health system? Because to deliver on UHC, and health security. So huge task, optimizing processes and care delivery through digital tools like AI is going to be very, very important going forward. So for us in Norway, NORAD, the Norwegian Development Agency, we have been moving from early engagement on digital health with focus on evidence, what works, is it scalable, the impact of that, and so on, to now trying to have a balance in the regulatory and the governance, so to reap the benefit of this technology, because the technology is developing so fast, nobody is keeping pace, right? So from that to this, from evidence on impact and scalability and sustainability, and the gaps that we saw at that time, to now regulating, chasing the technology with regulation. So we have to strike the balance, right? And that's why, with a purposeful and sufficient funding and support to our normative partners, to our technical partners like Health AI, we can do that together. I will come back to some of the points because I have colleagues to respond.
Thank you. I'll just tell in brief that India has a very large cohort of young population, and we have a demographic dividend. So therefore, the adoption and diffusion of technology is extremely impressive in India. We all know that the youngsters are born in the AI age, and there's no problem for them. There's no discussion of legacy technology or anachronistic technology moving forward. So that is not a problem for us. But the problem is to blend innovation, adoption, diffusion, work together, take everything together. And building an ecosystem for R&D is our biggest challenge, according to me. So, well, we think we are better off as far as the adoption and diffusion of technology is concerned. That's our strength.
Thank you. Maybe you can just one question from the service.
अभी फिलहाल हमें भी ना 15 मिनट बाद जल्दी भी कहीं तो कहीं पकड़ लेंगे कोशिश करें तो हो ही जाएगा
हमारा सेशन नेक्स्ट
which will have the credibility of the working of the device judgments. Because basically AI judgments are probability in nature. So, but those standardization, what are the systems are there, already those things are available.
I would love to take because this is one of the main impacts AI has on the work we do. AI is blurring the line between what is medical device and what is digital solution. So from before, we have this picture in that medical devices were made in rich countries and then sent to low and middle income countries with no infrastructure and capacity to use them. So in my time, for many years ago, WHO estimated that 40 to 70% of medical devices that are in the LMICs were not in use. But before, now with AI, we add another layer of complexity to approving, assessing, controlling, and so on. So that's why my point about localization is very important. And we have always to think access before starting creating a new device or building a new device. Access for in where these devices are going to be used. And the point of the data set, how this model, these products are going to be trained is very important now. Because the main shift with AI is, before it was human who were defining the logic. Now it is the data who is defining the logic. And this is a big deal.
I'll be a little brave and maybe add a few points. Thank you, sir, for the question. So I have come across a lot of research which does exactly what you say. They're testing out a device in a population for which this device was not created for, and then the study is only for a short period of time, and then there's no follow-up. So I feel this actually points to an evidence gap. It would be great to look at research that addresses the felt needs of clinicians. Do they really need that device for this particular clinical protocol or clinical workflow? How suitable is it for our population? Is it addressing a real felt need? And once it has been implemented, is there a longitudinal follow-up? And is there monitoring that goes on afterwards? So I think that would also perhaps add valuable evidence which could, give us insights that we need for governance, of course.
Just a quick question, because then I think I'd like to push back to Monica and
My question is regarding
particularly asked you about so, in terms, I'm also a PhD scholar in public health, and also a clinical doctor. So, I wanted to ask how are you considering AI use in terms of publishing and how the students should be having a separate ideas and how do you make this standard? Like this work is not written by AI. How the AI can be integrated in good
Thanks for the question. Perhaps it's a bit out of scope for the panel, but I think it's inevitable. People are going to use AI, and we know that that is going to be part of the future. What we try to advocate for is you acknowledge that where you have used AI. So, for example, for language editing, that is another way of creating equity. If you're going to be writing in a language that perhaps you may not be comfortable with, scientific communication is in English for the most part. There it has its uses. But what is important is authors acknowledge that they take responsibility for what is there in the manuscript, and they own their data and they own what they're trying to say about their data. So, but it's still a very nascent field, and I think there'll be a lot more regulations that come up in the future.
Sorry, just one question. Is that okay? Just 1 minute. Sorry, just one question because we also work in the same space from Kuchibeli. So, a lot of LLMs are at the last mile digitizing the health work or healthy cashers and all that. So, my question is basically to Dr. Purva and Vidushi. Is the government thinking of creating a national framework for kind of standardizing LLMs which works in the last mile in order to ensure that you meet certain standards? Because multiple of us partners, national and global partners are working in, but there is no such national level framework on that. So just wanted to ask.
Thank you for that question. It's a very, very important point that you have raised. So we are aware that in the context of India, we are taking a sectoral approach. So the different sectoral regulatory bodies are laying down the principles and the guardrails and the points that are to be, the ethical values that are to be incorporated while designing and developing a model. That being said, as far as the last mile connectivity is concerned, that is a huge concern, and there is still thought processes that are going on, and I don't think there is a ready-made solution as of now, I must admit that. But you have raised a very important point, and for Ashas, we are trying to give them tablets, and we are holding hackathons, and we are holding competitions amongst youngsters, startups who are trying to create models which will suit specifically, say, Asha, because these are very, very specific needs. So after the need assessment has been carried out, we are throwing open a competition, and we are asking the public and the youngsters, startups to come with solutions, and then we would look at it and then adopt it, but not any one size fits all. So thank you.
Right. Thanks a lot. So as a conclusion, Professor Sharma, you said at the beginning you really wanted to hear the panelists and learn from what they have to say.